Allison.
Hi, Michael.
And welcome to Dean's Discuss COVID-19. This is our weekly podcast in which we delve into the research and what we're doing both in the School of Medicine as well as the School of Veterinary Medicine here at UC Davis.
Well, today we're going to talk about the disruption this pandemic has caused in our nation's food supply chain, the health of those in the food industry, and what UC Davis is doing to help find solutions.
It's such an important topic that's important to all of us. All of us eat, and food is important to our nutrition and our well-being. So let's get into it a little bit.
Well, I've just moved to Sacramento. I'm on my 11th month here as dean, and I didn't realize how Sacramento was such this place for all different kinds of food. And I was really pleased to meet Chef Santana early on. And, he's really developed this type of thinking about food as medicine. And as doctors, so often we think about, I'm prescribing pills. But veterinarians, I know all too well about, you got to try this diet or that diet, but food as medicine is incredible. And then when we think about people can't get the food they need, that really impacts their health, particularly if they have chronic illnesses like hypertension and diabetes.
Yeah, we sometimes take it for granted in a country like ours because we go to the grocery store and we find everything we need, and we got we're spoiled in this country compared to a global scenario. And then when it got disrupted with the pandemic and we started to see either shortages or things that we normally would be able to get, it got people to think about that. And then on top of that, we began to worry about even going to the grocery store, about the fact that we had to go to pick up the food, but was it safe? And that brought up a lot of interesting questions about, how do we shop? What are the ways that we can go safely to the grocery store? And it involved a lot of the things that we're doing, physical distancing and personal protective equipment. And then we also learned the vulnerability of the food supply from the workforce, those workers that were on the front lines that were exposed, and both in the early part of food processing all the way to the grocery stores. So along the lines, during the pandemic, we began to appreciate not only where our food came from, but also the value of and the importance of food within this country. One of the things I was going to ask you about is, and all of us were, restaurant goers, and all of that stopped. We stopped going to restaurants, and of course, they're severely impacted. And the entire food supply was really disrupted when that happened, because so much of that food was going to restaurants. And when that was halted or cut off, the manufacturers had to find other ways to distribute their product. And so I know you probably haven't been to a restaurant for a while, Allison, and you really worry about that. But what are some of those folks doing to help those people that may be food insecure?
So
I
I've been
know you're
really
involved in it.
impressed with, I know the restaurants are really working to try to get food to people who are food insecure, and I really applaud them. There's multiple groups that are working on that actively. One of the things that's happened with COVID, it's really pointed out the disparities, the differences between the people who get healthcare and the people who have issues with getting food. There's no grocery store, for example, in their neighborhood. They don't have a car to get to the doctor or get their medicines. Those are all things that are really important, and food is key to our health. And we want people to have healthy food too. We want to make sure that they limit their salt and sugar and fat and all of that. So I know that there are leaders in our community really working towards trying to think about that as a health equity issue and trying to get food that's healthy out to those people who need it. And I am really excited about that, and hopefully we'll have more about that, those opportunities as we go forward. We have a wonderful community that's incredibly gracious about looking out after their fellow man and woman in the community, and it's really really heartwarming. But I do think as this goes on, I am worried about getting patients essentially food. And people have actually taken to writing, food prescriptions so that, patients will think about the things that they need to eat and the things that they shouldn't be eating. It is really unnerving to see the lines at the food banks out, in the national news.
I think that was shocking. It also,
More shocking.
did point out, as you say, the discrepancies in the wealth gap in this country and the ability of those folks to be able to get food. And so as those food banks opened up, you saw those long lines immediately happen. And that's really a warning sign for us that we don't have, while we have abundant food production in this country, the distribution of that food and the availability of that food is not equal. And the social disruption of that really brought that out immediately. One of the ways that that happened too was through the school systems. When the
That's right.
schools were no longer having the kids come to school, they depended upon those lunch programs and those food distributions through the school systems. And so they had to figure out other ways to do that. And as you mentioned, the community groups, my wife is involved in the village harvesters, and during they harvest fruit from trees that are abundantly producing but don't have an outlet, and then distribute that to the Yolo County food banks. Those kind of community based groups like that came forth and really tried to pick up the slack. And the restaurants, as you mentioned as well, tried to do that as well, to try to redistribute that food to where it was needed. And it's taken a while to do that. So when we think about the cost of a pandemic, and we think about an infectious disease, a lot of those calculations don't take into account the ripple effects that happen in our society. So we think of it as, gosh, it's going to make people sick and we need to stop it at the border, or we need to test for it. But we sometimes forget the fact that and this is really brought to bear during the COVID-19 pandemic, is all of the ramifications that a pandemic can have in the economy, job losses, and the food supply is all part of that. And when that's disrupted, of course, that really affects stability of the family life. It could affect the individual family.
Yes.
Around the world, food insecurity can lead to global unrest, actually, in countries. There's been food riots in South America, in Venezuela, over this last year. This was even before a pandemic was involved in that. So, we have to realize that the pandemics don't just affect our health and our hospital systems, but affect the entire society, and that includes food supply.
Well, we're really lucky at UC Davis because we've got the top ag school and the top vet school and school of medicine, school of nursing, and multiple great brains that can think together about these issues. But, I do think that we are going to need to be mindful as physicians and caregivers about are our patients actually getting food? Are they getting their medicines, and are they getting food? And particularly with the recession and people's income, it's we can't just always assume that everybody's getting their 3 meals a day like the children. It wouldn't be on someone's radar to think about, was your child on free lunch and free breakfast? And now that's changed. So it's really, as leaders in the community, I think we need to be starting to ask those questions. I'm really worried that things are not going to get better as quickly as everybody thought, and this is going to become an issue. My hope is that the children go back to school because in a safe environment, so that we can begin to make sure that they're getting the things they need, like food.
One of the interesting I guess, side effects of having disruptions like this is people become more aware. They may actually go into gardening at their own home more. And And you mentioned the College of Agriculture and Environmental Sciences here at UC Davis, which was really the first college that the whole university grew around and is #1 in the world. And they are working at a variety of ways to look at food. I heard last week a group that examines milk and the constituents of milk and how that affects the ability of an infant to respond to an infectious disease. So
Yes.
they think about it all the way from the molecule all the way up to the field. And the neat thing about that is we're connected also at UC Davis within the entire UC system. Agriculture and natural resource system involves all 10 campuses. And when it comes to agriculture and the ability to grow food, it means a collaborative spirit across multiple campuses. And part of that is to look for innovative ways to have sustainable agriculture, to have a safe food supply. So we partner also with the California Department of Food and Agriculture. A very important part, we have a series of laboratories that are set up specifically around food safety. And that means testing and making sure the food is safe. And that is all the way along the lines of the chain of the food supply. If you don't have a safe food supply and have confidence in that, we're all affected by it. We all remember spinach being taken out of the restaurants in 2006. And, you know, the university banded together and formed centers around food safety because of that incident to try to make sure. In California, we produce so much food for the whole nation, and that's part of our economy. So when that's disrupted, it affects all of us.
Yes, and that goes right back to our topics in the past of innovation. Part of Aggie
Yeah.
Square, which is going to be research buildings and learning environment, right? Stone's throw from my office is going to be the Alice Waters Food Institute. And part of that is actually to begin to teach young children about food and nutrition and how to cook. And that goes back to the beginning of our conversation with Chef Santana and this idea of food as medicine. He's been able to locally source, I think, almost 50% of the food that is served in the hospital, which is incredible. It's probably one of the top hospitals for food in the country because of Chef Santana. So we're really thrilled. But this will really bring Aggie Square with the strengths of UC Davis Agricultural into the partnership with the School of Medicine, School of Nursing. So I don't know, maybe we'll have to get food on the veterinary part too. We'll have to work on that too.
Yeah.
I'm sure my beagle would volunteer to be one of our test subjects.
Probably so. Well, you know, this is so important. We have also nutritionists that think about the food supply for our animals as well. And because we have, a huge industry around that, we're often asked questions related to the nutrition of animals as well. So we have specialists that are parallel in the School of Veterinary Medicine that are focused on species-specific nutrition. We had an unusual dietary problem with dogs that developed cardiomyopathy last year because of a food that was improperly derived and fed to a susceptible, in this case, golden retrievers, and they developed heart problems. And our nutritionist and our cardiologist work together on that. You know, those are the kind of things that are really collaborative across our institutions. You mentioned agriculture, engineering, medicine. When it comes to food, that interdisciplinary research is really, it comes to bear because to have precision farming, to have the ability to have sustainable agriculture, you need multiple scientists involved to understand nutrition of humans, to understand the psychology of food. That's where we really depend upon the medical school, the sociologists coming together and thinking about how do we change people's habits to allow them the tools to have access to food, but also the knowledge of why they should be eating good and nutritious food.
Well, you've kind of just defined the topic of precision medicine, which is maybe something we can unpack
Yeah.
in the future because, precision medicine, one thing is, um, crafting a menu for that individual person. And maybe that's on their genotype or it's food or it's something specific to them. And, personalized medicine, I think, is really going to be something in the future. And again, it goes back to kind of what we're talking about with Aggie Square, being really innovative. Well, this has
Yeah.
been really a great discussion, and I'm looking forward to more of these talks. I'm Alison Brashear, the Dean of the UC Davis School of Medicine.
And I'm Michael Lermore, Dean of the School of Veterinary Medicine, and you've been listening to Deans Discuss COVID-19, which is our weekly podcast. And please come and join us again for the next episode.
And we welcome your questions and ideas on future topics. You can email us at deansdiscuss@ucdavis.edu. And in the meantime, you can visit ucdavis.edu/COVID-19 for the latest coronavirus research and news from UC Davis. We'll see you next week.